Today we'll be discussing the effects of structural racism, specifically the implications that it has on health. So what is structural racism? Structural racism is essentially the reinforcement and perpetuation of discrimination through established systems such as housing, education, healthcare, etc. This type of racism is often hard to recognize, resulting in inequality across generations. To exemplify the detriment structural racism has on our health, we can look at the case of redlining. Redlining began in the early 1930s as a way to segregate neighborhoods. To quickly summarize the practice of redlining, the FHA, also known as the Federal Housing Administration, created color-coded maps of neighborhoods that separated them based on their roadworthiness. Neighborhoods that were predominantly black were given the color red, hence the name redlining. Areas that were colored red were deemed hazardous or risky. Because of redlining, African Americans were unable to receive loans that were backed by federal government insurance programs. Therefore, many turned to private loans that were predatory in nature, with high interest rates, causing many to foreclose. This rise in foreclosure led African Americans to largely rely on rentals, creating housing inequality. Additionally, if African Americans were able to afford a home without the use of a loan, they were often swayed from white neighborhoods due to the fear that they would devalue the homes in said neighborhoods. So what does this have to do with health? Premature births, as well as maternal health in general, has been thought to be influenced by the history of redlining. Studies have shown that infants born today, whose mothers resided in areas that were deemed hazardous, are more likely to be premature than those whose mother resided in areas that were labeled desirable. Alabama has one of the highest rates for infant mortality in the United States. As of October 15, 2023, 3 maternity wards are preparing to close. These wards reside in counties that are predominantly black. To receive care, individuals will have to drive at least 35 miles in order to reach the nearest hospital with a maternity ward. While the ER may be able to deliver these babies, if the infant is premature, appropriate resources to care for the child, such as a NICU, will not be available. If African Americans are more likely to deliver premature and reside in maternity care deserts, the likelihood of complications is high. Black women are already statistically more likely to experience pregnancy complications and or death than white women. So recognizing and understanding the systems that perpetuate health inequalities is an essential step in the promotion of equality and improvements in health.